Let me see if this is gonna go. Something just went crazy different. I lose y'all?
No, I hear you.
Okay, but
Hi, Paul. Sorry, I think for some reason I have got some AI related note taker who has just joined the meeting. So I don't know if you're able to maybe get rid of that.
see if it's on your side. If you could hit, you got AI on your end?
Yeah. Sorry, I'm a bit slow on the technology here. I'm trying to disconnect.
Yeah, I am. I'm trying to see if I can stop it on my end.
Yeah, sorry. This whole AI thing's taking over.
Okay, Kevin, I think we can go. I think we're good to go.
Okay, great. Well, I want to welcome everybody. Thank you for joining us this morning. It's September 3rd, 2025. It's 8:30, and I want to welcome you to the City of Charleston Health and Wellness Advisory Committee meeting. Appreciate everybody taking time. I know your time's very, very valuable, and we appreciate you taking time for the City of Charleston to help our city become healthier. And we are into September, so summer has gone by, and we're starting into those fall months now. And September is Health and Wellness Awareness Month, which is not a single event, but an umbrella term for numerous health observations and campaigns that'll take place throughout September. Some of those examples are Healthy Aging Month, Blood Cancer Awareness Month, National Recovery Month, and National Suicide Prevention and Awareness Month. Each campaign focuses on different health conditions, mental health, or wellness practices, aiming to educate public and promote well-being. Also, a few more. There's Childhood Obesity Awareness Month, National Food Safety Education Month, and National Fruit and Vegetable Month. So busy month, and a great month to be in the health and wellness conversation. A couple other things that's going on coming up that I wanted to mention. Sunday, November 9th, from 1 o'clock to 5 o'clock at Stony Field, which is next to Riley Park, is the Cooper River Bridge Run Kids Run. It's a free event for children 12 and under. It's going to be lots of fun and lots of other activities followed. And of course, Paul's very, very involved with that, as most of you know. Do want to let you know that Susan Johnson and Kimbo Yee sent their apologies. They had a conflict, not able to be here this morning, but so we do miss them. Appreciate them letting us know that they would not be able to make it this morning. Paul sent out minutes last Friday, I believe. Can I get a motion to approve the minutes from August 6, 2025, please? If not, I'll make a motion that we approve the minutes for August 6th. Can I get a second?
I second.
Thank you, Dr. Richardson. We have a motion to approve the minutes and a second. Any additions, deletions, or any further discussion? If not, all in favor of approving the minutes, please say aye. Aye. Any opposed? The minutes have been approved. So next on our agenda, we have Recovery is a Reality. We have from the Charleston Police Department Public Awareness Campaign, we have Shadisha Mustafa, our opioid outreach manager. So Shadisha, if you would like to, we would love to hear from you.
Good morning, everyone. Am I able to share my screen?
Yes.
Okay, awesome. Let's see if this works. Can you all see my screen?
Yes.
Awesome. Well, good morning. Thank you all for having me. I am so excited to be here. So just a couple of updates about CPD's opioid outreach. I want to, it's not letting me go to my next slide. Okay, so I want to briefly talk about SCORE because that is how our opioid initiatives are funded. A little bit about our opioid outreach. SIMS data, which I'll go into what SIMS is if you don't already know. Collaboration, our goals, and then give an opportunity for you all to give some feedback. So our initiatives are funded by the South Carolina Opioid Relief Fund, SCORE for short. And I just, this excerpt is from the SCORF website. So the relief fund was created by the SC Opioid Recovery Act. So basically, nationally, there was a litigation with the nation and the pharmaceutical companies, and we won. And so that is how we ended up getting the SCORF funds. And it just helps us to address and remediate the impact of the opioid epidemic in South Carolina. So it is controlled at a local level. That is how we are able to fund our Narcan and other community initiatives. All right, so this is me. So opioid outreach manager. So I just put a little excerpt here about myself. So my purpose at CPD is to reduce the impact of the opioid crisis through prevention, education, and support. I serve as a connector between the community, law enforcement, healthcare providers, and recovery resources. My goal is to bridge the gaps in services, raise awareness, reduce stigma, raise awareness of the recovery options and treatment options, distribute harm reduction tools like naloxone or Narcan, as some people know it, and build partnerships that strengthen community resilience. And I have the belief that every life is worth saving. So harm reduction is a huge part of what it is that we do at CPD. So SIMS is our critical incident management system. We actually have a meeting every week with various organizations and partners. So most of the police departments, Charleston County Sheriff's Office, Mount Pleasant PD, North Charleston PD. We also have Charleston Center and a few other organizations like 180 Place, so on and so forth, who gather together every week on these meetings to discuss the trends and the fatal and non-fatal overdoses and just the at-risk assessments, which we log through our SIM system. And so this is just a little bit of the data, as you can see here. So the green is our at-risk referrals, which are pretty high. Our fatal events are the orange, our Narcan administered. So that's how many Narcan was distributed, at least what's recorded. It might not be 100% accurate. And then our blue are our non-fatal events. And so that this is not an all extensive picture of our fatal and non-fatals and at-risk referrals. We're still working on making sure that all organizations are on the same page with logging referrals. And of course, there are just some events that take place that are not recorded or there aren't police reports for because EMS might have responded to it. And so just keep that in mind when you're looking at these numbers. All right, so collaboration. So it takes a village, right? There's strength in numbers. And so lots of collaboration. We believe that collaboration is necessary. There's no need to reinvent the wheel or try to do it on our own as an agency when there's other organizations that's also working to combat the same crisis. So 180 Place, which is the homeless shelter downtown. You have Favor Low Country. They have peer support services. Same with Wake Up Carolina. Then we have the Hope Center, who does a lot of work with the homeless population as well. Charleston Center, and then all the various police departments. We also work with them. And I'll get more into some of the specifics of what we are trying to do with those organizations in just a moment. All right, so goals. Everybody wants to know what the goals are, right? So community outreach is goal number one. So building community partnerships and problem solving to improve trust between police officers and citizens. Because though I am an opioid outreach, I do work for a police department. And so that means I have to consider what the relationship is like between the police department and its citizens that it serves and how we can help build trust and connection between the citizens and the police department. And then central investigations, goal number two. So there is an addiction crisis task force that includes all the other organizations I named, as well as Berkeley County, Goose Creek Police Department, a few other organizations, the DEA, and so on and so forth, where we get together to facilitate support services for overdose victims to reduce the likelihood of future drug overdoses. So we talk about the trends again, not just in South Carolina, but some of the trends nationally, how other people may have been trying to combat those trends and if they've been successful or not. And then ongoing outreach, so post-overdose outreach, doing follow-ups for individuals who had non-fatal overdoses, following up with families of individuals who had a fatal overdose, the naloxone distribution, especially in those areas where they're deemed as hotspots. And so there's a good bit of use or overdoses that take place in those areas. That also includes Narcan pop-ups. And so, especially again in those high incident areas, public service announcements. And so we have our PSA that we did this year. We featured some videos from individuals who may have been in active use, individuals who may have had a family member or friend who was in active use, which can be viewed on the City of Charleston's Recovery is Reality website. Also, you can view our newsletter, which we upload monthly. So our Recovery is Reality newsletter is also on that City of Charleston's website, and we will have our September edition posted by Friday, this Friday. And that's the PSA aims to spread awareness and reduce stigma, because there is a lot of stigma surrounding substance use and what that looks like, and all those things. And then future goals is to continue to work on efforts, prevention efforts through education, going into schools, speaking with students, speaking with faculty and staff at those schools, and then having community trainings, which would be partially Narcan trainings, partially just educating the community about what opioids are, what this crisis is, why there is a crisis, and what we can do to combat that together. Okay, so now I just kind of want your feedback really briefly. Let me go back actually to collaboration. So I am currently working with the Charleston Center to try to put together some community Narcan training slash what they call in the know. So being in the know about what's going on in the community regarding substance usage. And we're hoping to start that sermon series at the end of the year or beginning of the year. And then also a new development with our PSA. What we're looking to do is we identified a couple of programs in Charleston that work with youth who have had substance abuse issues themselves. And so we're hoping to be able to feature some of the youth on our PSA next year so that people know like this is a problem that is across all ages and is not just specific to a certain age group or a certain population of individuals. And then also maybe feature some more individuals who are currently in services with Hope Center or 180 Place, who can speak to kind of the struggles of substance abuse and substance use and trying to get into recovery. And that is about all that I have, but I'd like to hear your feedback. What is it that you feel like the City of Charleston Police Department could be doing better to better use their funds and resources that have been allocated? And what are some things that you thought we might have been doing by now that we aren't? Just kind of wanted to hear some of your feedback if you have any questions or concerns.
Any questions for Shadesha? Shadesha, if I was going to ask you, it's great we've got those partnerships with all these other groups. Are we working together with our fire department as well?
So I actually met an individual from the fire department whose name I can't remember at the moment a couple weeks ago, and we did have a discussion. We do want to meet further to discuss what their policies and procedures are on administering Narcan and kind of see where the conversation goes from there. So no official meetings yet, but hopefully soon.
Okay, very good. Paul, do you have something?
Yeah, just a couple of questions. And what are we finding mostly in our community right now? Is it fentanyl? Is it opioids? I mean, but they're all connected. But I mean, what are you finding? What's the hardest thing that we're having that we're needing the Narcan help with right now?
That's a great question. For a while, it was fentanyl, but it did recently change. And unfortunately, I don't have my notes in front of me to tell you. There's like a slight shift. Fentanyl is no longer, fentanyl is still obviously an issue, but I don't think it's the number one substance we've been seeing. But I'm happy to look into that and get back to you about that.
And is there any activity? I'm sure there's plenty of activity on the colleges with getting the Narcan around and all. How is that? Whose region is that Sarah's side or your side, or how are the colleges all being engaged in this?
Mm-hmm. So I haven't yet partnered with College of Charleston. They are a part of our SIMS meetings. Maybe Sarah can speak to that a little further. I know that recently, I believe Charleston County Sheriff's Office was able to get in a locks box there. And so that is an incredible move, because then they're able to just, without question or judgment, grab what they need. That's another form of harm reduction that we really like. And so outside of that, I'm not 100% sure, but I'm happy to get back to you on that, or maybe Sarah, excuse me, can share some insight on that.
I'm happy to share a little bit. Would you like me to do that now or wait until?
Go for it. Go for it.
So we do have a really good relationship with the local colleges. We currently work with the Citadel and we are doing Narcan trainings there. We also are working with them to install nalox boxes across their campus, which is just the nalox box, which I have a picture of it in my presentation, but it's basically can kind of go next to like the CPR AED machine just because as like a first responder. So we're working with the Citadel on getting those installed. We gave them like the first half and then we're gonna get with them and deliver the second half hopefully in the next month. The College of Charleston has great relationships with a bunch of different organizations. Favor Low Country does a monthly Narcan training down there. And then we usually get invited out a few times a year to kind of table at events, which Shadeja, I can get with you and maybe that's something we can co-do. We have one coming up this month with College of Charleston. And then from the prevention piece, we do work a little bit with Charleston Southern, where we'll go out and we haven't done the Narcan piece or anything like that, but they'll have like a mental health day and they'll invite our prevention team out. So it's definitely something we would like to expand and see what we can do for Charleston Southern and also, some of our local community colleges. So still an area for growth, but we are in the process of doing some things with them.
Kevin, just one more follow-up on that. So I know the homeless shelter, Hope Center is very engaged in getting the message out and getting it in hands. Do we do anything locally in our city public buildings to have some of those boxes next to our first aid or our AED kits or anything? Do any of our city buildings have those?
So I'm not aware of any city buildings having them. I know that all the Charleston police departments do have Narcan boxes, but we are working to move those Narcan boxes because outside of the Narcan box that's in the lobby and headquarters, no one is going to go knock on Charleston Police Department's door and be like, "Hey, can I get some free Narcan?" So we are working to identify locations to move those 5 boxes to other areas so that they can be more accessible.
And then I'm gonna give you one last shout out. Would you want to tell everybody about the red box in your lobby?
Yes, thank you. And so we do have a box in our lobby. It's a part of the drug take back. And so individuals, you can drop off anything from medication or whatever other substance you would like to drop off in those boxes. And we actually recently, I want to say about a month ago, went to Columbia and did a big drop off to drop off those boxes, those medications. So anybody can just come in, no questions asked, drop off any medications that they no longer need or use or any other substance in that box. And it's just an easy way for them to not distribute, excuse me, get rid of those substances that they no longer need. Thank you for that, Paul.
And I might ask one last, I'm sorry for taking up the time, but
You're good.
there's a lot of city meetings going around and community meetings and all. And it just seems like I hope that y'all have an opportunity to be, or maybe we could ask for the opportunity that whenever the city meetings for y'all to have a little table out there to do with education, like when they're doing something with the low line or they're doing something with the any kind of public meetings. It's a wonderful opportunity to introduce that to the rest of the community. That might just be something to reach out to see if we can connect in some things.
Yeah, I think that would be great. I'm if you're able to bridge that gap, I'm all for it. I think that would be amazing.
Well, Kevin and I will work on it.
Yeah, that's right.
Thank you.
Good. Shadesh, just one more question.
Mhm.
Like I have Narcan at my house. I have some at the office in case I need it. I'd love to have it in my car, but I was told that may not be the best place to keep the Narcan due to temperatures, particularly in the summer.
Yeah.
So I just wanted to ask you recommendations on that, or either you
Yes.
or Sarah. So,
Yeah. So I typically keep I'll open up the box and take the Narcan and put it in my purse because it can get really hot in South Carolina in the summer, like you said. And you don't want it to exceed, I believe it's a temperature of 77. I could be wrong, but it's roughly 70 something degrees. But we know when we get in our cars in summer, that thing in our little car might read 90 to 100 degrees, depending on what time of year it is. So I don't know. I know that might be a little different for you because I'm assuming you don't carry a purse. You may, and that's fine. But I carry mine in my bag just so that because I carry it with me where I go. I don't know, Sarah, if you have any recommendations where to keep it, but as far as wanting to keep it on your person, I would carry it. I don't know if in your pocket would be the best idea either. I carry mine in my purse or like a little satchel.
Okay, thank you.
Mhm.
All right, any other questions?
Kadesha, can I ask one question? Can you tell me what the at-risk referrals are in the data? What is that
Yes.
classified as?
I'd be happy to. So at-risk referrals, let's say, for example, a police report comes in and there's an individual who, like, I recently read a report where an individual was at a gas station employee called the police, said that so an individual at the gas station looked like a zombie. He was under the influence, admitted to using, but he wasn't overdosing, but he did admit it to using and using frequently and discuss with the officer how frequently he used. And so he would be put in as an at-risk referral because he didn't need Narcan at the time because he wasn't overdosing, but he is at risk for an overdose. And so that at-risk referral is basically at risk for an overdose.
Thank you.
Thank you for asking that question. Great question.
Very good. And Shadesha, you can also see Morgan's comments in the written comments. So just going back and forth as well. So I think this is a good connection for you. So
Awesome.
All right. Anything else for Shadesha? No other questions? Well, if not, we will move on to the Charleston Center Prevention Programs and Sarah Hoss, our opioid initiative coordinator for Charleston County. So, Sarah.
Thank you guys all for having me. I'm going to share my screen. Let's see.
Haven't come up yet.
Hasn't come up yet. Sorry. Let's see.
Still not there.
No?
Is your button green for share?
Is it there now?
Not yet.
Sorry, it looked like it was sharing. Let's see. Can you see it now?
No, now it's starting to come up.
Okay, sorry about that. Thank you guys for bearing with me. But I'm just going to take you through what we are doing here at the Charleston Center. And first, I like to make sure everybody knows what we do at the Charleston Center. These are just some of the different services. We have our withdrawal management. We have a new life unit, transitional care unit, which that's our inpatient units. And then we also have our outpatient, which we do adolescent and adults. Then we have our medication assisted treatment. We have some specialty programs such as our ADSAP. We have a peer program, drug court, and then we actually have sobering services, which is kind of a new program, new initiative that we are rolling out. And that is where if somebody is, getting in trouble for like a public intoxication, instead of having to go to jail for the night, law enforcement can bring them to our sobering services unit. So that's something new. Not sure if you guys had heard of that yet, but it's exciting just to kind of keep people out of jail if we can help it. And then we have our prevention programs, which they do a lot of education in schools and to the community. They do a lot of presentations, they do a lot of events, and they use evidence-based curriculums. And then we have other services, peer support. We have a urine drug screen lab, and then we do therapeutic behavior services. So just a little bit about us to get started. And I'm going to talk to you guys about what we're doing with our SCORF. So thank you, Shadesha. You kind of talked about what SCORF is. And so I'll just jump in with some of the different things and initiatives that we're doing. So we conducted a sequential intercept model mapping of our system, and I'll show you that. Increase harm reduction efforts strengthen post-overdose follow-ups, develop unique partnerships, strengthen community coalition work, develop a data dashboard, develop a phone app, develop a media campaign, and then enhance staffing for services. So this is a picture of our sequential intercept model mapping of our system here in Charleston. And this is where we gathered key stakeholders and we sat down and we tried to kind of map out our system. And the goal of this is to give people resources so that we can try to keep people out of the criminal justice system. And so this is only SCORF initiative. So I told you a little bit about our prevention team, and they do a lot of these things as well, but this is just the SCORF piece of it. But in FY 2025, we distributed over 5,000 Narcans, and that's just Charleston Center. That's not county departments, which I can show you those numbers shortly. And then that's not even Charleston as a whole. There's tons of other community distributors out there. And so we really are saturating Charleston County with Narcan, which I think is really, really cool. We also distributed over 2,000 doTERRA, which that's a drug deactivation system. So it's just a way to safely dispose of medication that's expired or no longer needed. We distributed over 1,000 medication safe storage devices, and that's really trying, if people have like the more highly diverted prescriptions, is to educate and encourage people to keep those prescriptions locked up and safe, right? To just kind of create that safety right there. We did 31 trainings, and our most popular trainings are, of course, the Narcan training. And then we also do a fads and trends training where we really kind of get into what's happening here in Charleston. And that's a presentation that we only do for 21 and up. We don't allow that to be recorded just because we want to educate, but we don't want to give anybody any ideas, right? So that's only for adults, but it is a really good training. So if you guys are ever interested in that, just reach out and let us know. And we reached 987 residents through those trainings. And then we participated in 93 community events, reaching over 6,000 residents through those. We get a lot of requests to come table, whether it's the libraries or big events. And so that's really what those community events are. And then we participated in 55 outreach events, reaching 1,813 residents. And our outreach events, those are really more targeted. And I'll show you some of the data that we're able to use to kind of target those. But, Shadeja mentioned those are, okay, we're seeing a spike in Charleston County and we're going to go out and we're going to do a Narcan pop-up, or we're seeing a spike in this area, we're going to go table and pass out Narcan. So those outreach events are just really more targeted than like our community events. So this is our media campaign, really just trying to reduce stigma. And then the other part of that campaign is really just kind of educating on Narcan. So that's what we're doing with Adams Outdoors. And then we also were able to work with CARTA, and we were able to wrap the bus in the 1, 2, breathe, the Narcan one, and then the reducing stigma one, which I get really excited when I see these downtown. This is something that we were able to do with Gas Station TV. And this is the data dashboard that we were able to put together with the SCORF funds. And this is public facing. So anybody can access this, and there's the different tabs, but this is just pulling information so that we have Charleston's data, right here available, and that we can use this information real time. So you can see this is the 6,000 naloxone kits distributed. That is the different county departments. And then this is just another image of that. Like right now, we're only keeping track of the county departments, but like I said, there's a lot of community distributors in Charleston County, so a lot more Narcan is getting out there, which is exciting. So this is information that we get from OD map. So these are all suspected overdoses, but this really helps us gauge where we need to be and what we need to be doing. So we can kind of follow these trends and we can say, okay, we see that the summer months overdoses tend to increase. So we really need to increase our outreach efforts, or maybe we're seeing a specific day of the week, just to kind of follow those trends. So this is information on the dashboard that we get from the coroner's office. And this is around the fatalities in our county. And we have 23, 2024, and 2025 up there, but this is just a clip from 2025. And one of the things I think is really interesting is that when you look at the fatalities by age, you can see that every single age group is impacted. All right, so Shadeja talked about SIMS, and I've talked a little bit about OD MAP, but we really, SIMS is something that's really coordinated from the law enforcement agencies. So as the Charleston Center, we're really just here to support the law enforcement agencies with follow-ups when they need it with our peer support team. And then OD MAP, I'm not sure if you guys are familiar with that or if you guys have heard of it, but this is where EMS enters suspected overdoses. But this is helpful in the sense that we can get out there and provide immediate resources to the community versus, you know, waiting for some of the information from like the state, which takes a while to clean, and that's important. But this is the more immediate, we can do something about this right now kind of data. And these are just some snapshots from OD Map, so you can kind of see what it looks like. And you can really see, this is Charleston, about how the ODs, the overdoses are really starting to kind of spread out and kind of hitting some of our more rural areas. And so these are just some of our coalitions that we're a part of and different community partners that we work with. And like Shadeja said, you know, it takes a village. We all are in this together, and it's just really great to have support from all the local law enforcement agencies, and then all the different coalitions, and just the partnerships in Charleston are really strong, and we're really fortunate to have that here. So we are responsible for applying for SCORE funds for all of Charleston County government. And so we include Charleston County Public Libraries in that. And these are just some of the initiatives we have going with them. We do Narcan trainings. They invite us to community events. We were able to provide prevention and recovery books for the libraries that they are able to give out. People can take them. They don't have to be checked out. They can just have those books. We do some youth programming, and then we were able to install the nalox boxes, which that's a picture of the nalox box, in every single library in Charleston County. And believe it or not, their lives have been saved. We know that libraries have used the Narcan from the nalox boxes 2 different times and saved somebody's life. And they've only been up for a year. So we also are installing the nalox boxes in as many county public buildings as possible. We're also trying to expand to some more rural areas. And then we're working with community partners on like the Leave Behind programs, increasing community distributors in Charleston. And then of course we have the jail vending machine with the sheriff's office. The sheriff's office has the mobile units that, you know, they're rotating around the community. And so you guys are getting a sneak peek of the app that we have built. It's Bridge to Hope. Information on this app is for the whole Tri-County area. So it includes Berkeley, Dorchester, and Charleston. We are currently live now on Apple. We've had a little bit of trouble with Google, so that's why we haven't done the big press release and the big unroll of this yet. We are so ready to, but we're partnering with Favor Low Country on this. And they are having a peer support specialist that is available 24 hours. You can call them, you can text them, you can email them. So that's going to be a really exciting tool for our county and for surrounding counties as well. And if you guys have a second, I can show you just a little clip of how the app works. So yeah, you'll be able to just kind of click in what you're looking for. There's a bunch of different buttons, like if you're not sure where to start, we can give you some guidance on that, but it can take you right to the directions of where you need to go, the phone, the website. And any questions?
Any questions for Sarah? Sarah, I've got a question for you. You were saying you had those boxes in the county buildings. Are there any in the Charleston County schools, in the high schools, or is there any plan for that?
So that's actually really exciting. That I think, gosh, that's happened a few years ago now, but every single school in Charleston County does have a no-lox box, and that was through, I believe, SCORE funds as well.
Okay, great. Thank you.
Yeah. And Charleston County School District even expanded that to where they wanted to have Narcan like on their like buses for after school activities and by their sports fields. So they've really expanded that, which is cool because not every county has done that yet. Charleston's on the lead in that, but they have the no-lox boxes in the schools, and they might even have a different type of box in the schools. But the important thing is they have the Narcan in the schools, and then they've added additional Narcan throughout.
Great. Outstanding. Great work. That's awesome. That's outstanding and great presentation. Thank you so much. Any other questions for Paul?
I just want Sarah or Shadesha. I know a lot of times some people will be worried about whether they should or should not give it if they're suspected of somebody that's passed out. And I think I heard back when we first started talking about this, it's even if you give it to somebody, it's not going to hurt them. It's not like it's if there's a doubt, don't have that doubt if they look like it. Can you just maybe clarify, expand on that a little bit better than I just did?
Yeah, so what we give out in the community is 2 4-milligram doses of Narcan. So relatively low dose of Narcan, and that 4-milligram dose is really unlikely to harm somebody. So if you suspect that they are experiencing an overdose, you would of course want to activate emergency response, and you would want to go ahead and use the Narcan, administer the Narcan, and it will not harm them. And I don't know, Shadesha, if you want to elaborate on that.
I mean, just what Sarah said, and I always tell people give it 2 to 3 minutes to take effect. You don't want to just keep shooting Narcan. Once you give your first dose, give it a couple minutes to take effect, and then if that individual is still unconscious, you can administer another dose. And you always want to try sternum rubs first to see if that would bring them to consciousness.
Very good. Any other questions, Paul?
Well, I'll be glad to share both of their contacts with this group. Because if we've got an event coming up or an opportunity that they could be a part of anything in the community to help get their message out or just to continue to spread the word, I'm sure they would love to be able to have us out to reach out to them. So again, Sarah's at the Charleston Center, and then Shadesha is over at the police department, but any of us can try to help connect with each other. These are 2 wonderful programs, probably best kept secrets in many doors because people just don't want to know about it, but we need to make sure they do know about it so they can react if they need an opportunity for it.
Well, thank you so much, Shadesha and Sarah. Great presentations, a lot of outstanding information, and just great work that you're doing in the community. Thank you so much for all you're doing, and appreciate you taking time to share with us this morning. So thank you so much. I don't think Dr. Durst is on right now. I know she had some information. Dr. Durst, are you there? I know she popped on and off, but it doesn't look like she's joined us right now, but I'll read, I've got it here. I'll read an email that came across from Dr. Durst. CCMS had their first school health committee meeting where they got a picture with the award they won from the SCMA for their work in the school district under chairwoman work of Dr. Jan Key and Dr. Catherine Outs. They had their Low Country Jazz Festival under our community service with Dr. Thaddeus Bell, a family medicine doctor, and his committee worked with closing the gap in healthcare. They gave out an award scholarship to a pharmacy student at MUSC, And congratulations to China Woodward, a second-year student at MUSC's College of Pharmacy, on receiving the $20,000 Thaddeus John Bell, MD, and Family Endowed Scholarship. China, who graduated from Clemson University and hails from Ridgeway, is interested in oncology pharmacy. Dr. Thaddeus Bell is chairman of our Community Service Committee, and they also won an award from SCMA. CCMS will have their Walk with White Coats, doctors walking with IOP Run Walk to help prevent child abuse. They're seeing an uptick in COVID and flu, and now is the time to get those vaccines. The flu vaccine can be found at doctors' offices and pharmacies. Also, wash your hands and please stay at home if you're sick. So just a few notes there from Dr. Durst. We appreciate her work in the community as well, and all the great things that Dr. Durst is doing. Next on our agenda, we are going to call on Dr. Katie Richardson with our community health update. Dr. Richardson.
Thank you, Councilman Shealy. I'll just start by building on Dr. Durst's message about vaccination season. Flu is right around the corner. We have already started seeing cases. Vaccines are available. I've seen lots of signs in pharmacies around town. We do recommend getting the flu vaccine in September or October, sometime before Halloween. It does provide good protection against hospitalizations. Even if someone contracts flu, the symptoms are usually much more mild. So it continues to be recommended for everyone 6 months of age and over, and should continue to be free for everyone who's insured to receive that vaccine. Department of Public Health also provides vaccines for the uninsured, and there will be a variety of outreach events around town, as well as free clinics offering the vaccine for those who are uninsured. We've also seen COVID numbers begin to rise, especially in our wastewater surveillance. Thankfully, it has not caused the increases in hospitalizations and deaths that we've seen in some previous years, although we are starting to see some increases in hospitalizations. Recommendations for COVID vaccine are a little bit more across the map due to some changes at the CDC, but the ACOG, which is the OBGYN group, does continue to recommend COVID vaccines for pregnant women who are at higher risk for complications. It also protects their newborns. The American Academy of Pediatrics continues to recommend COVID vaccine for those 6 months to 23 months of age. And then for those 2 to age 18, certain groups, such as those who live in the home with someone who is at high risk, vaccines are recommended for all those 65 years of age and older, and for those under 65 with underlying medical conditions. And that can be, you can get your flu vaccine and your COVID vaccine at the same time. We're also starting to see some more outbreaks of varicella or chickenpox, as well as pertussis or whooping cough. That often occurs as our vaccination rates have dipped in school-age children, but that those do then require kids to be out of school, and certainly puts infants as well as older people at risk. So please watch out for those and heed the recommendations. If you get a letter from your school about cases happening in daycare or school, and most importantly, talk to your doctor or provider about vaccines, both for adults and for children. They are really your local expert. Dr. Durst and the Charleston County Medical Society and all of our providers around what vaccines are best to continue to maintain health. And then lastly, I wanted to mention the RSV, or respiratory syncytial virus vaccine. There's one for pregnant women, anyone 32 to 36 weeks, between September and January, can receive that vaccine and protect themselves as well as their newborn. Infants under the age of 8 months during RSV season can receive a different vaccine, monoclonal antibody, but basically protects as the vaccine does against respiratory syncytial virus. Those over the age of 75 also will benefit from that vaccine, and those over the age of 50 with underlying conditions. Moving on, I did send Paul a few flyers that he hasn't shared yet, but he will, about events happening around town. There's an Early Steps Expo at the Royal Missionary Baptist Church in North Charleston on September the 20th from 10 to 2. That will provide a lot of information around 4K options, free 4K options, as well as local childcare. It'll be very kid-friendly, lots happening there. There'll be a gospel health festival on the 13th of September at the Church House of Ministries Worldwide in Latson. That will be from 10 to 1:30. The theme is around diabetes, so there'll be free health screenings as well as a lot of education around diabetes there, and it's free to attend. And finally, the MUSC mobile van will be providing cervical and mammogram screenings from 10 to 2 in 2 locations close to Charleston, at the Goose Creek Health Department on September 23rd, and at the Charleston County Health Department on October 8th. Appointments are needed for these. If someone has insurance, that will be used, and those generally are totally covered screenings. If they do not have insurance, the Best Chance network program will cover those, may cover those costs, and that QR code will help folks to be able to connect, to get an appointment, and to reach out to the Best Chance network. And then lastly, I don't have information to share now, but we'll send to Paul and have him share out. The Department of Public Health and Low Country Region will be convening a youth advisory council. And that will be youth from across the Low Country region. We hope to have representation from all 11 counties. But we want to hear from our youth. We want to make sure that our messaging out to the community is appropriate and is appealing to those groups. So we want to make sure we're prioritizing about their health, what they want to prioritize. And so it's both to please help us recruit for this council, but also if any of you have initiative or campaign or whatever that you might want to bring in front of this council, we would be happy to do so. We'll be meeting monthly virtually, and we'll be hoping to get as much feedback from them as possible around public health initiatives, not just at DPH, but in the community. So I think I'll stop there. Happy to take any questions, and thanks again for having me.
Yeah, thank you, Dr. Richardson. All right. Any questions for Dr. Richardson?
I don't mind asking Katie any questions at all. Katie, I'm really, this youth group I'm really excited for, and would love maybe next year sometime, maybe y'all do a presentation for us on it. A curious question in y'all's, we'll talk about physical activity and healthy eating, because that seems to be what we heard from the school district and earlier about kids count and those type things, about the lack of physical activity going on. So I'd be curious to know how that all is playing out and how we can stay engaged in hearing that voice.
Yeah, I think those will be very important topics and certainly ones we'll bring up. And so, for instance, if the Cooper River Bridge Run wanted to come in front of this group and talk about outreach materials or how to get more people involved, ways to get older kids involved, those sorts of things. That's what we're hoping that this group will do, that we'll come up with sort of some of those issues, and the group will bring some of those issues to light. And then we'll really have them help us to maximize whatever those issues are, those campaigns, those initiatives. So they'll bring up some of the topics, we'll bring up some of the topics, and I would love to talk more about it. It's really just starting. We're going to pilot it in Low Country region and then hope to expand it if it's successful. The age range will, I don't have it in front of me, but it will be from like high school through age 24 or so. And so for some topics, we may divide that group into younger and older ages, depending on the sensitivity of the topic. But we will be able to have representation and feedback from the whole range of youth.
And could you go back one more? Did you say when the health departments will start doing flu shots?
I did not say. We do not have our flu vaccine supply yet. So as soon as we have it available, we start to then schedule. Unfortunately, we will not be doing our school located vaccine clinics this year. We just don't have the funding and capacity for that. But we are very fortunate in Charleston. The Charleston County School District is a VFC provider, a vaccine for children provider. And so they have provided some of those flu vaccines in the schools in previous years. And hopefully we'll be able to continue to do that this year. And because we're not doing that, we are hoping to have more clinics, maybe after hours or weekends, to provide those flu vaccines for the school age population, just not in the schools as we have previously.
Thank you.
Any other questions? Dr. Richardson, I just wanted to mention with your Youth Advisory Council that the West Ashley Center for Advanced Studies has health and wellness related majors in there. And that may be a good source to go to. I know I'm sure that all the administration there would be excited to have a participant from that school, but they kind of specialize in health and wellness with some of their majors. So just wanted to mention that as a good source. So
thank you. I didn't know that, but I will share it with you. And if you don't mind sharing it with them, I'll be happy to answer any questions they may have.
Yeah, I certainly will. And yeah, I appreciate that. Thank you.
Thank you.
All right. Any other questions, comments on here? Okay. Well, thank you so much, Dr. Richardson. A lot of great information. And thank you for your presentation this morning and taking time out of your busy schedule as well. So we'll move on to community health and wellness updates. Anyone have any updates?
I have an update.
Brush, yes.
Good morning. And Paul won't let me not have an update anyway. So, but good morning, everybody. I was thinking, Katie, as you were talking, when you guys get settled in, it might be nice to see if we could get the Youth Advisory Council to give some feedback on how to talk about 988 or mental health or anything, because we do try to advertise things for kids versus how you do for adults. So when y'all do settle in, I'd love to reconnect about that. Love to get their feedback. It's one of the most important things. We got to get the feedback from the kids on how to reach the kids, right? We've all learned that the hard way. Yeah, I just had a couple updates. So just on the new Department of Behavioral Health and Developmental Disabilities, we're still going through lots of changes at Columbia level. We have the governor's office and Department of Administration currently overseeing our Office of Mental Health and trying to figure out who we are. And so it's slowing things down a little bit, but we hope that will pass. It would help to have a leader. We still don't have a leader for our new agency, but we're hanging in there. It's you know, as you can imagine, a restructuring is not an easy thing to get through. So, but we're currently trying to hire positions for school mental health, and we are rolling out our assertive community treatment team this month, which is a team of wraparound team of services for adults with intensive treatment, usually done in the homes in the community. They're the folks that kind of need us the most and need us to help them get in here for shots and medications and appointments. And I'm excited to say, after 2 years of trying to get an ACT team together, we have part of an ACT team, so we can kind of roll out and provide some really good wraparound services for some of our most needy patients. Other than that, September is Suicide Awareness Prevention Month, and I just got back into the office. I was looking to see what kind of events are happening this month. I couldn't find them, so Paul, I'll look after this and send you information on anything going on in the community for Suicide Prevention Awareness Month. And that's kind of all I've got.
Great. Thank you so much, Jennifer Brush. Appreciate all the work you do. Thank you.
I will say that Jennifer, Jonathan Kessler sent out some things for the VA that around that they knew some new things they were trying to. So, yeah, want to make sure we let everybody know what's going on.
Great. Thank you. Morgan Huey, do you want to mention Charleston Moves and what they're doing on November 6th?
Sure. I did want to interrupt Jennifer. So I'm on the board for Charleston Moves, which is a local nonprofit that advocates for safe biking, walking, and public transit. We're celebrating 20 years of the organization this year, the start of the construction of the Ashley River Bridge. So lots of great things with lots of partners to celebrate our biggest annual fundraiser. We call it Pedal and Panache. It's an event with live music, food and drinks, and a silent auction, and just some information and networking with this community. It's on November 6th, which is a Thursday evening at Edmund's Oast Restaurant, the outside space at the restaurant. So it's always fun. I'll be there if anyone is interested. And you can look at the auction items. There's some really cool local packages. I've done them sometimes for gifts, and you don't have to come to the event to bid on the auction and get those. So check that out, and thank you guys.
Thank you so much. Jennifer Brush, did I cut you off? I'm sorry if I did. Did you have more? You're done? Okay.
No, I was done. Thank you.
Okay. All right. All right. Anyone else?
I'm not going to let Nick get away without talking about his thing coming up this week.
Yeah, no, thanks, Paul. Yeah, I was going to jump in. Yeah, just to remind everyone, I mentioned this when we met last time, but in recognition of Hunger Action Month, which is the national campaign that is launched throughout September, we have our 5th annual Walk to Fight Hunger taking place on September the 20th out at Wanamaker Park. This is where we've held it before. So just to let everyone know, please feel free, come out, share this. It's an opportunity for us to come together and recognize the challenges associated with hunger and food insecurity. We have some great tables there, a great community event, a lot of our community coming together to share what they do, and just invite everyone to come out and spend the day with us on Saturday, September the 20th.
Great. Thank you so much, Nick. Anyone else with the community update? Well, just want to tell you, oh, Paul?
I sent out a flyer from Lisa Lamb that was on her, if you clicked on the little the QR code, it would take you up to to look at how do you determine whether some diabetes questions and other stuff. And I just want to make sure that I pass that on, just if you had a chance to look at it. Lisa's a wonderful asset in our community for the pre-diabetes. I'd just like to remind everybody to keep an eye out on those items.
Very good. All right, anyone else? Y'all, great meeting today. A lot of outstanding information, and you've shared some incredible things we're doing in the community. And I can't tell you how much we appreciate the efforts that everybody on this committee makes to make our community healthier, and we appreciate it. And like I said, when I started, I know your time's valuable, and thank you so much for taking an hour out of your morning this morning. I know it's a busy time with it being early September and things starting to move forward with Health and Wellness Awareness Month. And just want to tell you how much I appreciate each and every one of you. If there's nothing else to come before this committee, then we stand adjourned. Thank you so much.
Thank you,
Thanks.
Councilman.
Everyone.
Thanks, Paul.
Thank you.